Hello everyone. After listening to this presentation, my goal is for you to better understand the communication technologies, persuasive communication, and presentations involved in a physician's assistant position at Fletcher Allen Healthcare. Chances are that you have used different communication technologies, persuasive communication, and presentations to teach, learn, network, and even help others. But have you ever used communication to change someone's life and health? As a communication student and a future nursing and physician assistant student, I have often wondered how effective communication will play into my chosen career field. To find out more and to see just how crucial it is, I interviewed Gregory Ale, a physician's assistant at Fletcher Allen Healthcare, specializing in cardiology. Let's begin by discussing communications technology in this field. Certain modes of communication are used daily by providers, like physician's assistants and physicians, but they require backup in the form of generators and alternate planning. Email, word processing, several computer programs, and a phone system are all integral to daily functions, as are cell phones and pagers for the on-call providers. Electronic medical records, or EMRs, are also used daily. They have a speech component and a word processing component. The provider can dictate to the EMR, and it processes his or her speech for patient medical records. Sometimes the EMR crashes and there exists a backup medical record system. If there is a power outage or generator problems, there is protocol for that also. All elective care is then canceled. All admissions are diverted to other facilities and manual equipment is used. We have discussed communication technology and different modes of communication for physician's assistant. Now, let's explore persuasive communication. Much of Gregory Ale's career involves this type of communication. Communication with patients requires persuasive communication. Discussing things like their diagnosis and prognosis certainly may require these skills. Recommendations must be given for care. Limitations may also be discussed as far as lifestyle, diet, activity, and other such restrictions. Communicating prescription information and dosage instructions may also require persuasive communication, as might communicating continued care and referrals. A patient may benefit from seeing a specialist, surgeon, or a different type of physician, and the patient may also benefit from extended services, and follow-up visits are generally recommended to continue care. Greg asserts that communicating with his boss requires a bit of persuasive communication strategy. He says that pitching ideas to the higher-ups also requires patience and an open mind. Any ideas may be presented in a different manner and may also take some time to get presented. Giving reports and updates to the boss and or administrators may also require some persuasive communication. Concerning the public, there are a few ways in which persuasive communication is utilized. One, direct advertisement for goods and services is used. Also, word of mouth. Greg tells his patients, if you like the care that you're getting, tell your friends. And also, the reputation of the providers and their prestige in the field is a greatly persuasive tool. Now that we've explored both communication technology and persuasive communication as they pertain to a physician assistant in cardiology, let's look at the role of presentations as utilized in Greg Ale's field. Presentations play an important role in our physician assistant career. Greg presents at educational functions, and continuing medical education is crucial. He presents at Scientific Journal Club regularly and has also been asked to present at the American College of Cardiology's scientific sessions this year as well. For such presentations, Greg will use PowerPoint and may also include charts and graphs in addition to other slides. When presenting, Greg considers expertise and appearance to be the two most critical aspects. Presenting to patients, while on a smaller scale, is every bit as important, if not more so, than presenting to groups. The most crucial thought to keep in mind is that if you stand up at the foot of the bed with your arms crossed and lecture, nobody will listen. If you pull up a chair, take the time to listen, and then talk, it will be heard. Then you can type it into the discharge instructions. With patients, Greg likes to use models of the heart when talking to them to get them acquainted with the anatomy and the functions of the heart. And as far as giving news, especially bad news, Greg says, let the results speak for themselves. In conclusion, communication is crucial in the medical field to a physician's assistant. Communication technology, persuasive communication, and presentations are all integral means of communication in this particular career. Communication in a medical setting is complex and multifaceted for providers like physicians and physician's assistants. Through my interviews, I was able to gain a greater understanding of communication as it applies to a provider at Fletcher Allen Healthcare. Everyday providers like Greg Ale are using various forms of communication not only to teach and learn, but to change and save lives. Thank you all for listening.